Everybody likes to say age is just a number. But trust me, not all of us are actually convinced. Even when we say it, we say that for the heck of it. But yes, being a doctor, we do encounter many such situations where people actually go ahead and prove that age is just a number. And I'd like to recount the story of a patient whom I recently treated. So one night I got a call from the ER stating that an old lady, around 96-year-old, had come to our ER with severe back pain and somebody who had been bedridden for around a week or so with inability to walk. So when you think of a 96-year-old lady in the middle of the night who's not able to walk since 8 days, you think it's normal old age and you would like to not think beyond that. So I told my emergency consultant to do whatever is needed from there and admit the patient, and then we'll take care from there. So next morning when I saw the patient, I saw the lady was otherwise perfectly fine. Up here, totally perfect. But she had a problem. She was somebody who was all active, moving around 8 days ago, and suddenly she had a fall, and ever since then she could not walk. That was the only problem which she had. Then we did an MRI and we found that there was a large compression on the thecal sac in the lumbar region. So we could finally realize that that was the cause of her problem. That was the reason why she was weak. So we did the other workup, the cardiac workup, the blood parameters, and trust me, everything was better than that of a 25-year-old person. And apart from that, the attitude of this lady was also phenomenal. She was one sprightly old lady, but attitude of the patient was also something which was remarkable. She was ready for everything that we were throwing at her. So we said, okay, now you have a compression of the spine, you might need surgery. She said, okay, fine, let's go ahead, without even batting her eyelids. So now suggesting a surgery to a 96-year-old lady, especially a spine surgery, is something where I also have to think twice. But when we look at the other parameters, there was no reason to not offer her that. She was perfectly fit from all other point of view, and the most important thing is she was doing everything on her own till 8 days ago. So the only problem that she's had was for the past 8 days, and that too because of a very specific reason, the spine, which we thought we could treat surgically, and that was precisely the reason why I offered her that. So we did the surgery, and trust me, within around 17 to 18 hours of surgery, she was up on her feet. She was standing up, and the very next day, we discharged her walking. So this 96-year-old lady who came to us on a stretcher 3 days ago walks out of the hospital after undergoing a spine surgery. So if age is not a number, what else does this prove? So that is one beautiful story which I thought I had to share with you. It speaks volumes about the lady herself, but it also says a lot about where we've reached in terms of medical care. We are able to provide that kind of care to people nowadays. And one thing that I would like to say is, if age is the only reason for not availing a treatment, it is definitely not fair to that person. If everything else is perfect and age is the only thing, no, that's not something which we should really look at, and we should offer whatever we can, no matter what the age. Thank you so much.